Question number 1. A patient heart stop during surgery under general anesthesia. How many compression per minute should be administered if a carotid pulse is not palpated? Option A 50, B 60, C 80, and D 100. The correct option is option D. Why? The rationale is in cardiac arrest situation, high quality CPR guideline recommended chest compression at a rate of 100 to 150 compression per minute to ensure adequate perfusion of vital organ. Lower rates are insufficient to maintain circulation. Question number 2. What type of infection is rabies considered? A. Viral, B. Protozoan, C. Fungal, D. Bacterial. The correct option is option A. Viral. Why? The rationale is rabies is caused by a virus, rabies elisiva virus, which affect the central nervous system. It is typically transmitted through the bite of infected animal. It is not caused by bacteria, fungi, or protozoan. Question number 3. A patient, a 55-year-old patient with heart failure exhibits crackle upon lung examination. What does this indicate? Right side heart failure, left side heart failure, biventricular failure, or option D, congestive heart failure. The correct option is option B, left-sided failure. Why? The rationale is crackle or rales upon lung examination indicate pulmonary congestion, which is a hallmark of left-sided heart failure. This occurs because the left ventricle fails to pump effectively, causing fluid buildup in the lungs. Question number 4. An adult admitted with heart failure shows neck vein distension and slight peripheral edema. What do these signs indicate? Option A, pneumothorax, B, right-sided heart failure, C, cardiogenic shock, D, left-sided heart failure. The correct option is option B, and why? The rationale is right-sided heart failure causes fluid build-up in the venous system leading to jugular vein distension and peripheral edema. Left-sided heart failure primarily affect the lungs rather than the systematic circulation. Question number 4. A 55-year-old man presented with severe weakness and has been grieving and eating very little since the son's accident 3 months ago. The nurse suspect option A, mania, B, insomnia, C, depression, and D, schizophrenia. The correct option is option C. Why? The rationale behind this is persistent grief, loss of appetite, and severe weakness are classic symptoms of major depressions, especially after traumatic event such as losing a loved one. Question number 5. A nurse teaches a client with COPD assess signs of right-sided heart failure, which should be included in the teaching plan. Option A, clubbing of nail bead. Option B, hypertension. Option C, peripheral edema. And option D, increased appetite. The correct option is option C. which is peripheral edema. The rationale behind this is right-sided heart failure causes fluid retention leading to swelling in the lower extremity. Peripheral edema, while clubbing of nil bead, is a sign of chronic hypoxia. It is not directly related to the right-sided heart failure. Question number 7. A surgical procedure that must be performed within 24 hours is classed as option A, urgent procedure surgery, option B, emergency surgery, option C, elective surgery, and D is necessary surgery. The correct option is urgent surgery. Rationale behind this is urgent surgery is a procedure that must be performed within 24 hours to prevent complication, but it is not immediately life-threatening, unlike emergency surgery, which require immediate attention. Question number 8. Which phase of nursing care plan involve the action and implementation of intervention? Option A, evaluation, B, assessment, C, diagnosis, and D, implementation. So the correct option is option D, which is implementation. And the rationale for this is implementation is the phase where the planned intervention are carried out to address the patient needs. Assessment, diagnosis, and evaluation are other phases of the nursing process. Question number 9. A patient with pulmonary emboli complain of pain, dyspnea, and fear of dying. Which intervention is likely to help to reduce the patient's anxiety? Option A, administer oxygen is ordered. B, administer pain medication is ordered. C, observe closely for sign of pain and discomfort. D, listen to the patient's concern. The correct option is option D, which is listen to the patient concerns. And the rationale for this answer is anxiety is a common in patients with pulmonary emboli due to severe dyspnea and fear of death. Active listening provides emotional support and reassurance, helping to alleviate anxiety. Question number 10. A patient prepared for hip surgery learns about external pneumatic compression device to prevent. Option A, upper respiratory infection. B, decrease breath sound. C, deep vein thrombosis. D, bleeding at the surgical site. And the correct option is option C, which is deep vein thrombosis. Rational external pneumatic compression device help prevent deep vein thrombosis by promoting circulation in the lower extremity, reducing the risk of clot formation after surgery. Thank you.